Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
According to the American Cancer Society, more than 14,000 women die every year from cancer of the ovary. Ovarian cancer often goes undetected until it is spread somewhere else, usually within the pelvis and the abdomen. And once it's spread, it's more difficult to treat and is unfortunately frequently fatal.
One of those who lost her life to ovarian cancer was Christy Pitts, a physical therapy technician in sports medicine at Mayo Clinic. Christy passed away in February of 2014 at the age of 47 after a 9-year battle. Christy, while still alive, shared her journey with others in an effort to help shed light on the disease. September is Ovarian Cancer Awareness Month, and here to discuss is Mayo Clinic gynecologic oncologist Dr. Carrie Langstraat, and we're also joined by Christy Pitt's sister, Ms. Jamie Groebner. Welcome to the program, both of you, Jamie and Dr. Langstraat.
Thank you.
Yeah, Dr. Langstraat and Jamie, thanks so much for being with us. Jamie, first of all, our condolences. I'm sure this was a difficult thing for both you and your entire family.
Yes, thank you. I appreciate that.
And Dr. Langstraat, so you see patients with ovarian cancer day in and day out. Why is it that this cancer is often so deadly?
I think it is primarily so deadly because of the delay in diagnosis. There's no good screening test for ovarian cancer, and in addition, most of the symptoms of ovarian cancer are quite vague. So often it's abdominal bloating, changes in bowel or bladder function, and often those are sort of treated as though you would treat constipation or other less serious illnesses. So patients will often go months without having a CT scan or other imaging studies which are needed to diagnose the ovarian cancer.
In past years, though, have women started to not be so afraid or have been paying attention more to what's going on with their body? Is it getting any better?
I don't think it's getting any better. I do think people are more aware of ovarian cancer and understand that that is a disease that can cause those symptoms. But yet they're so vague, and so many people have constipation or changes in bowel function or bloating that are not related to ovarian cancer. It's hard to screen or do a scan on everybody with those vague complaints.
Jamie Groebner, I suspect that this might be reminiscent of your sister's story.
Yeah, I would say she always had constipation throughout her entire life and a little bit of back pain, but it was always mimicked because she thought that it was part of her PMS that was going on. And so that also is a shadow in the background. There's so many women who go through that monthly cycle, and the same type of symptoms mimic.
How did she first find out that she had ovarian cancer?
She had a lump in her clavicle, which was suspicious.
Really?
Is that unusual, Dr. Langstraat?
So that was a metastasis, Dr. Langstraat. It had already spread there?
Correct. It had already left the abdomen, which is not atypical. The clavicle is a little unusual for them to have clavicular lymph nodes that are involved. But it's not unusual for patients to present with stage 3 or stage 4 disease before it is detected.
By the way, the clavicle for some of our listeners, that's the collarbone. So, and there are some lymph nodes in the area. So her cancer had already left her abdomen, left her ovary, gotten into the bloodstream or the lymph system, and ended up in a lymph node up by her collarbone.
Correct.
And how long did it take, as soon as that lymph node was felt, that she was diagnosed? It must have gone pretty fast.
Actually, it was very ironic. At first, they assumed that she had a breast cancer. And so it took a good 2 weeks to actually find the primary because ovarian wasn't something they were considering at that time. All the other tests, her other organs showed clear.
So they ultimately biopsied that lymph node?
Correct.
Yep. And then they said, my gosh, this is coming from your ovary.
Right.
And then I assume she was referred to a medical oncologist, someone
Correct.
like Dr. Langstraat. Did you treat her, Dr. Langstraat? Do you remember?
I did
Do you know?
not treat her. No.
No.
And then what happened?
They anticipated her to be in a wheelchair, expecting her to be very, very sick because she was already diagnosed at grade 3, stage 4. And when the oncologist walked in, he walked back out. He was very, caught off at her health and the way she carried herself, and that he expected her to be very, very ill when she wasn't.
Now, Dr. Langstraat, for our listeners, explain that. Grade 3, stage 4.
Sure. So grade is what tumors look like under the microscope. So grade 3 being very angry and abnormal appearing cells compared to normal tissue. And it's a progression in some ways. So normal to grade 1 to grade 2 to grade 3. So grade 3, bizarre, angry looking cells under the microscope. Stage has to do with how far the cancer has spread. So stage 1 is confined to the ovaries. Stage 2 involves the pelvic structures but has not left sort of where your pelvic bones end. Stage 3 is in the abdomen, so up to your diaphragm, and stage 4 is either the liver or outside of the abdomen.
And we said earlier that what first got her into the doctor was that she had this lump up in the lymph up by her shoulder, her clavicle. And you said that's not typical. What is typical?
Typical is to see stage 3. So we see disease involving the ovaries, the pelvic organs, the omentum, which is a fatty pad that hangs from the stomach. And then often we will also see diaphragm involvement. So diaphragm is the muscle that helps us breathe. Just on that surface, there's sort of a skin that overlies the diaphragm, and that is often involved at the presentation of ovarian cancer.
Is there a lack of symptoms with regard to ovarian cancer because the ovaries are relatively small and so deep in your pelvis? The tumor has to get pretty big before you really have a symptom that'll take you to the doctor, and by that time it's already spread elsewhere?
Correct. I often have women think about pregnancy, which is a little odd, but if you think about how far along you are in a pregnancy before you notice the belly getting a little bigger, or you can see on somebody else that their belly is bigger, the uterus is already to the belly button. So your pelvis really can hide a very large mass before it becomes noticeable or even symptomatic.
And if every woman went to the doctor when she felt bloated, you would see, that's
Once
a
a
common
month.
female complaint, isn't it?
Once a month, yeah. I'd say even
exactly.
more than that, yeah.
But that is one of the symptoms, right?
Correct.
Constipation, that's the only symptom your sister had, constipation, correct? Before she saw this lymph node, felt this lymph node. Anything else? Constipation, diarrhea, bloating,
Feeling
diarrhea,
full.
maybe not. Maybe I overstated that.
Diarrhea plus minus, feeling full earlier, so not able to eat as much. Feeling like their belly is expanding, so maybe their pants get a little tighter or they're loosening their belts a little bit more. Sometimes back pain, sometimes shortness of breath or chest pain, which may indicate fluid around the lung related to ovarian cancer. Those are the main symptoms.
All right, well, we know the symptoms. We just wish we could catch it earlier in a lot of women. We're talking with Mayo Clinic oncologist Dr. Carrie Langstraat and Ms. Jamie Groebner, whose sister died of ovarian cancer about 3 years ago. Time for a short break.
When we come back, we're going to talk in depth with Jamie about some of the choices that she has made, what she has done to try to prevent ovarian cancer, the disease that took her sister's life.
You're listening to Mayo Clinic Radio on the Mayo Clinic News Network. Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
You know, Tracy, a small percentage of ovarian cancers are caused by an inherited gene mutation. The genes known to increase the risk of ovarian cancer are called breast cancer gene 1, BRCA1, and breast cancer gene 2, BRCA2.
I've heard of those before. Yeah.
Unfortunately. Well, these genes, at least we know about them now. These genes were originally identified in families with multiple cases of breast cancer, which is how they got their names, BRCA1, BRCA2. But women with these mutations are also 30 times more likely to get ovarian cancer than other women. We're back talking with oncologist Dr. Carrie Langstraat and with Jamie Groebner, who lost her sister to ovarian cancer in 2014.
So, Jamie, tell us about the process. Your sister was then tested, and she is a carrier of one of those genes, and you were too.
Correct. Mm-hmm. So her tissue samples were sent away after her first initial surgery to test for any type of genetic mutations, and they came back negative, and we were told that her cancer could have been environmental, and if there was any other, tissue samples that they could give later on to send again and look for that. Later on, she was tested, and during other tests, colonoscopy they sent some of her tissue, which also came back negative. And prior to her passing away, there was another option where her tissue was sent again to a third facility, actually. And that's when it was diagnosed that she was a BRCA carrier.
So you're saying that when she had the first 2 biopsies, including the surgery to remove her ovaries and uterus, that they didn't detect the BRCA gene?
None was detected at that time.
That
How
unusual?
can that show?
Dr.?
Yeah. How can that show up later on, Dr. Langstraat?
As technology changes, they spin the tissue down different, and certain cells are looked at differently. And each genetic institute that you send things to may not have the most
Gotcha.
up to date.
So the testing got better.
Yes,
So what do you remember about it? Were you pretty close to your sister?
very close.
And what do you remember about her treatment?
I remember being upset because we couldn't figure out why she got cancer. It took us years before we were able to get a family history down pat. All of my grandparents had passed away. My family didn't, you didn't look at that stuff back in the day. It wasn't important. And so it took a long time before we could identify where things were coming from and who was ill. And, it ended up being from my mom's side. And once we knew that she had a BRCA1, it changed the entire cocktail treatment that she was having for chemotherapy.
And once you knew that she was a BRCA carrier, how long did it take you? How long did you wrestle with that decision to find out for yourself?
I didn't wrestle with it. We found out 2 weeks before she passed away. And she asked me to promise to get tested for my kids. So I didn't have the same story, and that was a no-brainer. I watched her get defeated by a horrible disease, and that was not the way that I wanted my life or my kids' life.
How long was it from the time she was diagnosed until her death?
She was diagnosed March of 2005. She passed away February 21st of 2014.
Oh, that's a battle.
A real fight. And she had surgery, chemo, radiation, everything?
She did. She had surgery was March 10th of 2005. She had 6 cycles of chemotherapy, and after that she ended up doing an 18-month maintenance chemotherapy, which probably really set her up for success. That was something that she did once a week for 18 months.
So what did you do with the information that you were also a BRCA carrier?
So I did not get tested until September.
September of the year she died?
2014. Just kind of, needed to get everything under control with family and settle down before there was more bad news or good news, whichever it was going to be. In September, I got tested, and the call came in, and I was prepared either way of what to do. I knew exactly. I had already talked with Dr. Jamie Bockham, and we discussed if it came back positive that my steps were to remove everything and lower my risk as much as possible.
Do you have children? Have you had children?
I do have 2.
Okay. So that made it a little bit easier.
Yep, it did.
Yeah. Okay, so you then went ahead and had what's called a total hysterectomy, removing your ovaries and your uterus.
Correct. I did.
And that presumably, obviously, will prevent you from getting ovarian cancer. Are there other cancers that you're still at risk for?
There are a handful of mutations that don't have enough information to back which types I could be at risk for. It doesn't secure that I'm not ever going to get it. It just lowers my risk into 3% or less.
And it puts you into a category now called previvorship.
Yay.
Never had heard that word before. Dr. Langstraat, could you explain that a little bit? I think I can kind of understand the gist of it, but what does that mean?
So Previvor actually was coined by the FORCE group. It's a group of women that have BRCA mutations that are at risk of ovarian and breast cancer. And they coined the term Previvor to explain the group of patients that had the opportunity to do risk reduction strategies or approach their risk of cancer with taking out their ovaries and in some cases mastectomy. But they are facing their risk, knowing what could come, and doing whatever they can to reduce their risk of cancer.
Because we're at a point in medical history now where you can actually know what your genetics are, whereas a generation ago that was not. You had the family history, but that was it.
That was it.
Right.
Well, I had never heard the word either,
Yeah.
Previvor. So,
See, you learned something new, Dr. Shai.
Yeah, no kidding. I'm so glad I showed up today. So I have another question, and that what about the other family members? Do you have sisters, and is your mother living? And did all of them get tested? And daughters?
So my father refused to get tested. He only has one living sister, and they have no family history whatsoever other than being a farmer, maybe had, a little basal cell taken off of his cheek.
Well, what does BRCA gene mean for a male, Dr. Langstraat?
It actually means risk of breast cancer in the male. Sometimes pancreatic cancer and sometimes prostate cancer as well can be associated with BRCA mutations.
Okay, he's a farmer, said don't eat it. Okay, who else?
Sounds like a farmer.
My mother, she ended up getting diagnosed with a lung cancer in March of 2013 and passed away.
Well, your sister was still alive.
Yep.
She died before your sister.
She did. She got diagnosed in March. She passed away in August. And so, yes, they passed away about 184 days apart from each other. She refused to get tested because she didn't want to die knowing that it could have been her or her family members that may kill her daughter. So she was really, really upset with that fact and wouldn't do it. Eventually, we found out through her other family members who have a long line of cancers that populated into our family history. And my two brothers, they don't want to know. They seen enough with my mom and my sister that they don't want to get testing. They have children, and their children are okay to get testing, but they don't want to know.
It is definitely understandable.
It's frustrating.
Yeah.
So I missed part of that. Do you have daughters?
I have one daughter and one son.
Okay, and did your daughter get tested? Or
Not yet. There's some issues there that I'm kind of fighting with. They don't want me to force my children to be tested at this point because they're not of age to make their own decision, and so I'm wrestling with that.
Yeah, we're at that time in the history of medicine for these questions and these conversations to be happening. What else is happening at this time when it comes to ovarian cancer and awareness, Dr. Langstraat?
Yeah, what's new? What have you got that's going to be better?
So we do have some new therapies available, in particular new therapies for BRCA mutation carriers. There's a class of drugs called PARP inhibitors that have shown to be very effective in patients that have BRCA mutations or whose tumors have BRCA mutations. And actually, although the most evidence or the most benefit seems to be in these patients with the BRCA mutations, there is evidence that they work well even in patients that have no mutation. So that's probably the most exciting thing, is that we have new approval for new therapies from the FDA.
By the way, we've said that this is a bad cancer, and everyone knows that, but what actually is the 5-year survival rate? How many women who are diagnosed with ovarian cancer are actually alive 5 years later?
So there's quite a few factors that go into overall survival. If we look at all comers, stage 3 to 4, it's about 30%, 5-year survival. The things that make patients seem to do better are the patients that have complete resection of their disease up front. And those patients can have a median survival of around 5 years. So overall, 5 years.
Average survival, 5 years.
5 years if they've had a complete cytoreductive surgery, so complete debulking of their tumor, and then they have adjuvant chemotherapy.
Well, we obviously need something better, and hopefully PARP is part of the answer. All right, we've been talking with gynecologic cancer specialist Dr. Carrie Langstraat and Ms. Jamie Groebner, whose sister unfortunately died of ovarian cancer 3 years ago. Thanks so much to both of you for being with us.
Thank you for having us.